get started, just wanted to remind everyone that all attendees will be muted. So if you have a question during the webinar, feel free to type it in the chat log located on your right-hand side of your webinar interface, and your question will be answered during the Q&A session. Again, the copy of the webinar video plus the slides will be sent to every registrant. And if you're not able to receive the email for some reason, or you'd like to maybe refer the webinar to another person that you may find helpful, it's also available on demand at www.practicebuilders.com. Before we get started tonight, I wanted to introduce our sponsor for tonight, the Coding Institute. The Coding Institute's Consulting and Revenue Cycle Solutions offers a comprehensive suite of consulting services to help you sidestep audit triggers and claim more of your rightful reimbursements. So visit www.codinginstitute.com/consulting for more information to get a free special report titled The 7 Deadly Sins of Revenue Cycle Management. Just quickly, I wanted to touch on about who Practice Builders are. We're the leading private practice healthcare marketing firm specializing in helping healthcare practices achieve personal and professional goals. Again, we're founded in 1979, doing business since 79, so that's about 32 years now. We work exclusively with healthcare professionals, and we work with all specialties in all 50 states. Our core competence is e-media, social media strategies, in addition to helping any type of solutions that your practice may need, including staff training, comprehensive solutions, and long-term goals. And now I'd like to introduce the lovely Irene Doty, who is a senior marketing and training consultant at Practice Builders. Irene's special interest in healthcare reform tonight was started when she became the former corporate public relations director for Molina Healthcare, a multi-state managed healthcare company that specializes in Medicaid and government-related programs. Thanks, Irene.
Thank you, Lara, for that nice introduction.
You're welcome.
Welcome everyone to our Practice Builders webinar. I'd like to thank all of you for joining us this evening, and we are looking forward to providing you with an overview on this very hot topic of healthcare reform and how it impacts physicians and their practices. Excuse me. It's timely that we're holding a webinar on health reform this evening because yesterday marked the first anniversary of President Obama's signing into law the Patient Protection and Affordable Care Act. Now, it's commonly referred to by its acronym, the ACA, and sometimes negatively referred to as Obamacare. Whatever the nomenclature, no piece of government legislation has spurred such widespread disenchantment among physicians. According to a recent poll, in fact it was done in January, conducted by Reuters, and this was for both primary care and specialists, 74% predict that the law will make physician reimbursement even less fair, and 58% believe that it will hurt patient care. Now, we'll later discuss how ACA is already affecting doctors and the healthcare industry, but for now, let's go over tonight's agenda. Tonight, you'll learn a number of new things, or things that you may already know about healthcare reform. We'll cover an overview on ACA's major provisions, and we'll talk about how it's faring in political and legislative arenas at the current time. We'll also talk about how healthcare reform will affect physicians and their practices, and how you can survive these changes and actually realize opportunities. And I'm talking about opportunities in terms of branding, in terms of marketing your practice, training your staff in preparation for this new scenario, and also finding alternative revenue streams besides insurance-based reimbursement. Some of the salient points about ACA is that a lot will be spent covering the underinsured. That means a definite expansion of Medicaid, and we'll talk about that later. Also, a big facet of this is the creation of health insurance exchanges, and with that comes increased federal regulation of the insurance industry. Now, you will see an ACA, you will see these slides, so I'm not going to go over every bit of them, but I will talk about some of the most major facets of healthcare reform here. Let's talk a little bit about the creation of the health insurance exchanges. Uninsured and self-employed people will be able to purchase insurance through state-based exchanges starting in 2014. And federal subsidies will be available to low-income individuals and families. Also, with employer mandates, with employers who have more than 50 employees, a fine of $2,000 per worker each year will be imposed if they don't provide health insurance. Pre-existing condition exclusions have been eliminated for children, and starting in 2014, insurance companies will not be able to deny coverage to adults with pre-existing conditions, nor will they be able to charge higher premiums for pre-existing conditions. And we'll talk about the implications of that later. The insurance industry. Now, insurance plans will be required to provide dependent coverage for children to continue up to age 26, and states are now required to expand Medicaid to include childless adults. This is huge, folks. And this will start in 2014. And the federal government will pay 100% of the costs for covering these childless adults. So actually, the primary care workforce and the primary care community health centers, they're going to be the key winners of federal funding. Many of you may ask, is healthcare reform in critical care? Well, right now, the key linchpin that's going on, you can see it in the media, is what is called the federal mandate of individuals purchasing insurance, meaning that individuals must purchase insurance or they pay a penalty. Now, last December and this January, 2 U.S. District Court judges ruled that the federal mandate is unconstitutional. No provision of ACA is so beleaguered as this individual mandate. As a matter of fact, 76% of Americans view it unfavorably. And what is going to happen? I don't have a crystal ball, but what I will say is that ultimately the U.S. Supreme Court will either pull the plug on this mandate or they will uphold it. The insurance mandate doesn't go into effect until 2014, but many new regulations, as I mentioned before, are already happening, such as the requirement that insurers cover children with pre-existing conditions. And also states are preparing for a major expansion of Medicaid eligibility and the introduction of these health insurance exchanges, which will come about in 2014. I will mention that some states are still refusing to participate, so we don't know what's going to happen with that. So folks, should we be feeling euphoria or consternation? First, I'm going to discuss how healthcare reform is already impacting the healthcare industry. The winners, definitely Medicaid plans, big time, and also PCPs, whose Medicare charges comprise 60% of total revenues. And it's already starting already in 2011. And they will be receiving this incentive payment until 2016. It's already built into the reform package. Also general surgeons who perform major surgery in health professional shortage areas. This also will begin this year, and it will last until 2016. As I mentioned before, Medicaid is a big winner. There's a lot of money for Medicaid. And for the first time, Medicaid will be extended to childless adults. 16 million Americans are expected to be added to the Medicaid program. And these are childless childless adults. As you know, Medicaid usually, basically people who fall under Medicaid, they are between the ages of 18 to 35. Usually they are mothers with children. Now we're going to be seeing childless adults added to this program. And throughout the country, many doctors are trying to lower their percentage of Medicaid patients or eliminate them entirely. So the question remains, how will all of these people be covered? Some doctors, are avoiding their Medicaid patients for many reasons, so it all really remains to be seen on what's going to happen with this particular issue. Hold on just a second. We're just, okay, here we go. This is something that's very important. I did not coin this phrase, war on specialists. It's Wall Street Journal. They are questioning whether, actually they say that healthcare reform is posing a war on specialists. Already, last year, there was a 6 to 8% increase for family practitioners and other PCPs, and that's fair enough for primary care, says the Wall Street Journal, but if one area of medicine receives a larger slice of the government pie, another one must accept a smaller one. So a war on specialists, let's talk a little bit just briefly about radiologists and those physicians or those specialties that carry high technology. I can tell you right now that there's a strong belief among the healthcare reform policymakers that part of the biggest increases in healthcare are due to the inappropriate use of expensive technologies. So those will definitely be scrutinized. Also, cuts to specialty care last year. Cardiology, echoes were slashed by 52% in reimbursement. Caths, 24% decrease. This is big, big, big. This is very big for the cardiologists, big slashing. And, Medicare also for MRIs and CT scans, they've hired radiology benefits managers, they're called RBMs, to provide very, very close utilization controls over scans. And, this doesn't only affect radiologists, this affects a lot of specialists who also, for example, or oncologists who order cancer tests. So a lot still remains to be seen. But what is currently happening? Let's talk about what's already happened. The high-risk insurance pools. They were one of the earliest facets of the new healthcare law to take effect. They were originally intended as a temporary fix for those with pre-existing conditions, because in 2014 the law will forbid insurers to reject customers based on whether they are healthy or sick. Now last spring, Medicaid's chief actuary forecast that 375,000 Americans would join these high-risk pools. Last month, the enrollment is barely 12,500. Now, the administration attributes this lack of popularity to early growing pains, and they also attribute it to the lack of consumer knowledge of these plans, but state health officials and consumer groups are saying that the plans are still way too expensive for many. Healthcare insurance premiums are already on the rise. We're already seeing this happening. Because health reform mandates that insurers cannot charge higher premiums for people with pre-existing conditions. This means that ultimately what's going to happen, critics of the law, this is what I'll say, they're saying that exchanges will attract disproportionately sicker, costlier enrollees, and that this adverse selection, what's it going to do? Well, it's going to significantly drive up premium costs, and I think ultimately they will threaten the exchange's stability. Health systems, they are buying doctors. According to the Wall Street Journal, they're projecting that by 2012, this is scary, it's estimated that nearly 2/3 of private doctors will be salaried employees. Compare that to 2005, when doctors owned more than 2/3 of U.S. medical practices. So that means that private doctors will be salaried employees of larger institutions such as healthcare systems, hospitals, even managed care plans, and huge healthcare conglomerates. So what is to come? Well, first off, the health insurance, first of all, plans I believe are going to minimize their standards. Why? Because the health insurance exchange plans are going to be required to offer a package of essential benefits, quote unquote, essential benefits. But I ask you, what does essential really mean? Most of these questions still require answers that the ACA hasn't really answered. And what makes it so difficult to define essential is that, the concepts of what is medical and what is medically necessary have been so expanded in the last 20 years. I can't imagine how they're going to be expanded by 2020. So, the future is that there's going to be a question over what are essential benefits, meaning plans will minimize their standards. So if I had to take a crystal ball, what am I trying to say? What's going to happen for the future? I truly believe, and other health analysts do say the same thing, we may be moving toward an elitist system in healthcare. Analysts are projecting that we may be heading closer to Britain's system, where there still is definitely a market for private practitioners. My prediction is that a market will still exist for private practitioners who remain independent and not employees of healthcare conglomerates. But I also believe it's going to take marketing. It's going to take careful market positioning in order to catch the attention of consumers who have richer health plans, who buy into supplemental plans. So, what's going to happen? I predict there's going to be disparities in healthcare for the haves and the have-nots. And for those patients who can pay for the richer plans, it's going to be up to the private practitioner to market directly to them. So we can talk about this. This is what I believe in talking about. In the wake of all of this, what about our opportunities? What can private practitioners do? I really feel that we have to think about surviving and even thriving. And how can you do that? So that you can be more selective over your patient base. I believe that that's what you need to do. You need to be more selective, and you don't want to rely so heavily on government payers. So if you're going to be attracting these folks who fall into the category of people with richer plans, you need to brand yourself through marketing, because these people will have buying power. So I firmly believe that what's going to happen is that physicians are going to have to market to consumers with more favorable insurance or supplemental insurance to pay for these treatments that are not as considered essential by these health exchanges. And I really feel that you need to market your practice through a very careful marketing plan, not just spaghetti on the wall, see what sticks, see what works, but a very, very carefully crafted marketing plan. And also a marketing plan that uses such things as e-media and social media networking. Why? Because I think you're going to have to attract some of the younger demos, younger demographics who have richer plans. Another thing is for preparation. I believe that physicians need to train their staff in preparation for this. Please note this, 32 million previously uninsured Americans will enter our healthcare system between now and 2014. That's a daunting figure. We're going to have to figure out how to manage these folks, still maintain customer service, and still manage to do this in a very efficient way. And I believe we need to utilize best-in-class models of patient care. That means best customer service and the best way to handle phones, the best way to greet patients, and also handle operational changes for better efficiency. If you're a private practitioner, I think you're going to have a very strong edge in attracting these patients with the richer and the supplemental plans, because these folks are going to have more choice, and they're going to have more ability and knowledge eventually to shop through the healthcare market. There's other opportunities. Prevention and cash-based services. Medicaid and Medicare are now required this year to cover tobacco cessation services and obesity counseling, and under healthcare reform, both of the government payers, Medicaid and Medicare, these preventive services are going to be increased to 100% of payment rates. No co-payments, will be attributed to this. So my feeling is, change, whether good or bad, I think it's a breeding ground for opportunities, and it's up to you as a practitioner to make this happen for the better. So I ask, why not infuse cash-based services that are tied to these preventive service offerings into your practice? And not only the preventive service offerings, but also the cash-based services. As physician fees, and they will continue to be pressured by Medicare and other payers, it becomes more important than ever for practices to look at ancillary services as a means to generate additional revenue. You know what? Simply increasing patient volume, it's not enough. It's going to make you work harder, not smarter. So my recommendation is, think about ancillary services that can fit into the brand of your practice, such as nutrition and weight loss counseling, allergy management, if you're an OBGYN, hormone balancing, for example, there's physicians right now who are putting in on-site dispensing solutions in their offices. So there are opportunities there. Proponents of ancillary services, for example, Bill Jesse, who's the president and CEO of MGMA, he thinks that as long as the revenue side of practices stay flat or decline, physicians are going to have to find new sources of income, or they're going to have to go out of business. So, anyway, I'm turning this over to you, Lyra, to talk about our special attendee offer.
Thanks, Irene. Wonderful. Thank you so much. Before we go into the Q&A session, I just wanted to quickly go over our special attendee offers for tonight, and they're for tonight only. Practice Success Workshop for $7.95. Regular price of that is $14.95. So just for tonight, we are offering a savings of $700. And if a more convenient method for you is for us to come to you, we also have it as well, known as a strategic on-site consultation, and that's a $1,000 savings with that as well. You see here it includes a step-by-step 12-month strategic marketing plan customized to your practice, and it'll include a complete study of your demographics, your competition, and other factors that you may face when trying to achieve your practice success goals. So if you are interested in this offer, feel free to email us at info@practicebuilders.com or give us a call at 800-679-1262 to take advantage of these special offers for tonight. Okay, so now as we go into the Q&A session, there are quite a bit of questions coming through the chat box. So what I'll do to make sure that we, answer the questions adequately and give enough time to Irene to do so, I'll go through them as the order as if they were received. So just to make sure, we'll go through maybe 3 to 4 questions, and then if we don't get to your question, I do apologize. We will, we have your questions logged in as a report. So what we'll do is we'll have somebody contact you shortly if we don't happen to get to your question, to make sure that your question is answered, and you'll receive all of the information as well as any details about this webinar tonight shortly. Okay, so let me go to the first question, and I'll go ahead and leave this slide up too if you're wanting to know, again, more details about our Practice Success Workshop / house call on-site consultation. So that'll be up there for you, as well as the contact information. First question, Irene, I have here. They're saying, you mentioned the law which mandates individuals to have insurance or pay a penalty was ruled unconstitutional by one of the judges. Now, doesn't that make the entire health plan unconstitutional?
Excellent question. First of all, that Judge Vinson of Florida, this is interesting. He was asked to clarify by the Department of Justice's ruling about the individual mandate and whether it was unconstitutional. And he had said, this is what he said that he views the entire bill, excuse me, as unconstitutional. And he also believes that removing the individual mandate doesn't make the rest of the bill constitutional. So that is a big issue. But once again, all remains up to the Supreme Court in deciding exactly what they're going to do on that subject.
Great, thank you. All right, next question. Irene, you mentioned earlier that most physicians are totally unhappy with healthcare reform. Now, my question is, why physician leaders such as the ACP and AMA were in favor of this legislation?
You know, there, as I mentioned before, there is widespread disenchantment, and this was a poll that was taken last month from Reuters among physicians. A lot of disenchantment among physicians, but you know something? It is not apparent. This disenchantment is not apparent in the remarks made by leaders of the mainstream medical societies and groups such as the AMA, the AAFP, and the ACP. So though these physician leaders say that much of the ACA is good, and I read a recent article that Dr. Charles Cutler was defending the ACA, I'm afraid, in my opinion, this is only my opinion, I'm afraid their comments are just not in sync with obviously the recent polls of what physicians are saying.
Okay, great. Next question. It says that they're a private doctor, an OBGYN to be specific, and the healthcare system has been asking them to join as a contract physician. Now, if I don't join them, someone else sure will join them. So I'm very hesitant to be bought because I want my independence. But how am I going to survive with competition coming from major hospitals and their specialists already?
One of the things that I tell private practitioners who wish to remain private is this. You have an edge in remaining private if you position yourself in the market effectively through marketing. And I believe in the power of marketing for patients who do have more choice and who have better plans. For example, you were saying that you may eventually compete with the healthcare system because they may go out and hire another OB-GYN. But you know what? Bear in mind that the very fact that you are independent, that you are private, that you're not tied to any big conglomerate can be a big, big message point that you can sell in the eyes of the general public. This can actually work to your advantage if you craft your marketing messages effectively. Because there's going to be consumers, as I mentioned before, who still want top quality medical care. They don't want to go to a practice that may be treating them as if they're going through a mill. They're going to want the individual the individual care from that private doctor. So I think in essence, look at it as an opportunity, stay private, that's my opinion. And also, as an OB-GYN, you may consider adding an ancillary service such as bioidentical hormone therapy. So there's opportunities for you to stay private. You just have to kind of be creative, think outside of the box, and just realize that this is a time for you to be, you're faced with challenges, but if I were you, I'd want to be one of the winners in this entire scenario with healthcare reform.
All right, great. That's probably the most of the questions that we'll go ahead and cover tonight. Again, 2 points here. If you are interested in the special attendee offer for either the Practice Success Workshop or the convenient house call on-site consultation, you can either call us at 1262, or you can enter your name and contact information in the chat box you have there, and we will contact you shortly. Okay, and just a last word from our sponsor. Again, I'd like to thank them tonight, the Coding Institute. Minor coding and documentation errors can add up to a big chunk out of your revenue. In fact, physician practices alone lose $1 billion every year due to downcoding, delays, and repayments stemming from improper coding. So allow TCI's consulting and revenue cycle solutions help you get on the right path for a profitable and compliant 2011. Again, visit www.codinginstitute.com/consulting for more information to get a free special report titled The 7 Deadly Sins of Revenue Cycle Management. And again, I'll turn it back to Irene for closing remarks.
Thank you everyone for attending this webinar on health reform. I invite those of you who would like to talk more about how to position your practice for the future, or learn innovative marketing solutions, or the way to train your staff in preparation for healthcare reform. Call us at Practice Builders for more information. Call us about a workshop. And if you're interested in learning more about infusing revenue streams into your practice, call us at 1-800-679-1200 for a complimentary consultation. Thank you everyone again.